I'm going to start off addressing the question, what actually is multiple sclerosis? MS is an inflammatory disease of the brain, optic nerves, and spinal cord. And we call the brain, optic nerves, and spinal cord together the central nervous system, or CNS. Any region of the CNS can be attacked during multiple sclerosis. And the symptoms that patients experience depend on where the inflammation occurs. It's the most common cause of neurological disability in young adults that is non-traumatic. Multiple sclerosis was originally described by a French neurologist named Charcot in the 1800s. And here's an illustration of a brain of someone with MS from a medical textbook from that time. And this is a part of the brain called the brainstem, which is at the base of the brain, and here's the spinal cord. And these areas, these yellow areas, are places where MS has done damage. And we frequently refer to these areas as plaques or lesions. Now, these plaques or lesions are relatively hardened compared to the rest of the brain, and they represent scar-like damage, and that's actually what sclerosis means, scarring. So multiple sclerosis because there are multiple areas of scarring. Now, what actually is the damage in the plaques? Well, what appears to happen is there is an unraveling and disappearance of what's called the myelin sheath. The myelin sheath is a wrapping around nerve fibers. This is a nerve fiber, and it is encircled by this fatty membrane that protects the nerve fiber and also helps it conduct its electrical signals. So it's similar to the rubber insulation around an electrical wire. In multiple sclerosis, the myelin sheath is actually damaged and the nerve fibers are stripped of them. So what causes this damage? Well, we believe, actually I think I could say that we know that it's inflammation. So as a plaque or lesion is forming, there are a lot of white blood cells which cause inflammation, leaving the bloodstream and going to the central nervous system, the brain, the spinal cord, the optic nerve, wherever the plaque is forming. And these white blood cells release factors that are toxic and damage the myelin sheath. So this is supposed to represent a white blood cell. Normally these cells protect us from bacteria, viruses, even tumor cells. That's why we're supposed to have inflammation. But in multiple sclerosis, something goes awry, and the immune system begins attacking our own bodies. This is called autoimmunity, and in multiple sclerosis, the target of this autoimmunity is the myelin sheath. So the white blood cells enter the brain and the spinal cord. They release various factors, and that leads to degeneration of the myelin sheath. So here's a nerve fiber, and in this region, the myelin has been removed by the inflammation. Now, early on, neurologists had speculated that this was mainly a disease of myelin, but it turns out that in some instances, once the myelin has been removed, the underlying nerve fiber becomes damaged and actually can be split in half and then begins to degenerate. So, and this can even occur early in multiple sclerosis. There will be nerve fibers that are what we call demyelinated, simply stripped of the myelin, but they're still intact. They're still functioning, but the signals they conduct are slowed down because they don't have the myelin. But in some cases, the nerve fibers are actually cut in half and more severely damaged. This once again illustrates the three hallmarks of multiple sclerosis that we see in the plaques if we look under a microscope. These little purple dots represent inflammatory cells, white blood cells. This is a blood vessel, so these cells have migrated from the blood vessel, and this is in the brain of a patient with multiple sclerosis, so they've entered the brain tissue. And then they've caused, near the area of inflammation actually surrounding it, a lot of the nerve fibers have been denuded or stripped of their myelin sheath. And this is actually an electron microscopic picture, very, very blown up, which shows damaged myelin. You really can't see it there. Here's another picture of a nerve fiber that is stained in green, and in this particular image, the myelin is stained in red. And a region over here or here, you could see that the myelin is still around the nerve fiber, and together the red and green appear yellow. But in this region here, the myelin has been damaged by inflammation. The nerve fiber is still intact, but the myelin is gone. However, over here is an area where a nerve fiber has actually been cut in half or transected by the inflammation, and when that happens, it swells at the tip. And this is what we call a bulb, and it's a damaged axon. Or axon means nerve fiber, excuse me. So patients with multiple sclerosis can have a wide range of symptoms, and that's because the inflammation and the damage to myelin and nerve fibers can occur anywhere in the central nervous system. And where the inflammation and damage occur translates into the type of symptoms patients experience. So here is a cartoon of the brain, and this part is the cortex. And when there are lesions in these areas, you could have numbness and weakness on one side of the body. You could have difficulty with some thought processes. Lower down is what is called the brainstem, and this controls swallowing, eye movements, balance to an extent. So depending on where a plaque forms in the brainstem, a patient can have double vision, can have vertigo, slurred speech, swallowing difficulties. Nerve fibers in the brainstem also control facial movement, so someone can have a facial droop. Sometimes, depending on where a plaque forms, it could actually cause something called trigeminal neuralgia, which is recurrent sharp pains in the face. This area of the brain is called the cerebellum, and it coordinates movement, and lesions in this area could cause gait imbalance and tremor. Now, multiple sclerosis, as I said, also can affect the optic nerve. Here's a illustration of an optic nerve. Here's the eye, obviously, and here's the nerve that's conducting the signals that allow us to see. MS lesions can form in this nerve, and that leads to what's known as optic neuritis, which is decreased or cloudy vision in the eye. And also, because there's inflammation, there's often some pain on eye movement. Finally, multiple sclerosis could affect the spinal cord, and it could affect the spinal cord where it runs in the neck, through the chest cavity, even lower down in the lumbar region. Most commonly, it affects the spinal cord higher up. And when lesions form, you can get numbness or weakness, often below a certain level. So you may have the numbness from the waist down and weakness of the legs and the arms unaffected. If the lesion is or plaque is higher up, then the hands and arms may be affected. Also, nerve fibers which help us control the bladder and bowel travel through the spinal cord. So sometimes when there's spinal cord inflammation, patients have difficulty with bladder control. And finally, for lesions which occur in the spinal cord and the neck, there's a phenomenon called Lhermitte's, a Lhermitte sign. And what that means is that when you bend your neck down, it causes an electric shock sensation down the back. And this is actually Lhermitte, who was a neurologist at the turn of the century, who first described that symptom in patients with multiple sclerosis.